Oh, hi, Chandni.
Hi.
My name's Paul. It's actually nice to meet you, and thanks very much for your time today. The reason I'm here is because I came down from Cambridge to help out and ask a few questions, and I was wondering if you could possibly do that for me kindly.
Yeah, absolutely, Paul. Be more than delighted to help you with that. So as you know, my name is Chandni. I'm one of the periodontists, and I'm happy to ask as many questions as you have.
Yeah. So one of my concerns, is regarding my children. Should I be teaching my children in their early years about oral health care?
So it's quite important to try and instill that in children earlier on, because it's all about building good habits. And if you can build good habits with cleaning your teeth and your gums earlier on, it's easier to maintain that in adulthood.
Oh, I see. Okay.
And what that usually would involve is making sure that they're brushing their teeth twice a day, using interdental cleaning in between the teeth, and regular visits to the dentist and the hygienist as well.
Well, one of the problems is with my kids, they hate brushing their teeth. They just don't want to do that. So how can I encourage them to do that more often?
Yeah, that's a great question. And I'm sure it's not just your kids. I'm sure lots of children don't like doing it. I think it's just about trying to find what that child in particular might like. So trying to make it more fun, maybe letting them pick their toothbrush that they like, take them to the supermarket and get them to choose their brush.
Oh, good idea.
Little things like that make them feel more involved and like they're more in control of it. And maybe brushing together so that they can see you doing it, and then they might want to do it as well, because children love to copy what everyone else is doing. So those are all little tips and ideas that you can try and do to make it more of a fun experience.
Oh, excellent. Right. Okay. Yeah. And actually, one of the other things is, I'm so busy at the moment in my business life and lifestyles, and dropping off the kids and picking up the kids, and being a taxi driver and a chauffeur. I have been using my brushes on the occasional time and days that I do remember, but what can I do to actually make sure I do these on a regular basis? What things can I remember more often about those?
Yeah, so I think the most important thing, again, is just trying to build it into your daily routine. You've gone through most of your life not using interdental brushes, for example. So it's all about trying to build that into your daily routine and make it more regular for you.
Right.
And I think we kind of get into this trap that we have to do this in the morning, or we have to brush with interdental brushes in the evening. But actually, it's about finding the time in the day that works best for you. That could be in the mornings before you go to work, if that's when you have the most time, or in the evenings when the children are asleep, or even in the middle of the day when no one's at home. It's just finding that time in the day that works best for you, and using that time then to clean the teeth effectively. If you do that, start doing that every day, that will be built into your daily routine, and then it will become normal for you.
So does it make a difference if I do that before lunch or after food, or before food?
So with brushing the teeth, that should be done twice a day. So that's why we usually advise once in the morning, once in the evening. With the interdental brushes, as long as you're doing it once in the day, it doesn't matter too much when you're doing it. I would much rather you do it at one point in the day when you have time than go days without using them. And some things that can try and help you to remember to do them are putting things like reminders on your phone or things like that, until it becomes more of a habit for you.
Yeah, so you're mentioning about brushing my teeth and also using the brushes as well. If I brush my teeth twice a day, do I also need to use the brushes?
That's a very good question. So when you're brushing your teeth twice a day, what that's doing is it's brushing the surfaces of the teeth that you can sort of see when you look inside your mouth. And that's great. But it's too big to fit in between the teeth. The toothbrush itself doesn't quite fit between the teeth. So that's why you need to use a smaller brush, like the interdental brushes, to clean in between the teeth. Otherwise, you're actually only cleaning about half of your mouth. So that's why it's important to be able to use both.
Oh, okay. And also, should I have my teeth, cleaned on a regular basis by a hygienist?
So Your teeth should be cleaned on a regular basis, your teeth and your gums.
Yeah.
And how regular that might be depends on each person.
Yeah.
So when you see your dentist or periodontist, they will have a look inside your mouth and see what your risk is to gum disease. And then from that, decide with you about how often you should be seeing a hygienist.
Yeah.
The cleaning doesn't necessarily need to only be done with a hygienist.
Okay.
It can be done with a dentist, with a hygienist, with a periodontist. As long as your teeth are getting cleaned regularly, that's the most important part.
So you've mentioned to actually using a brush, also the actual brushes to actually live between my teeth. You've also now mentioned a hygienist. Doesn't all this to actually rather become expensive and things?
So I can understand why you might think that. You go to the supermarket and there are so many different products out there, and sometimes it can become overwhelming at which one you need to pick. But really what you need is a good toothbrush that you are able to use effectively. It doesn't need to be the most expensive toothbrush out there.
Should I use an ordinary toothbrush or an electric one?
As long as you are able to use the toothbrush effectively, you can use a manual or an electric, whichever one you prefer, as long as you're managing to use it well. If you're struggling to use a manual toothbrush, then it might be better to consider using an electric one instead. So a toothbrush, manual or electric, that you can use well is good. And even with the electric ones, it doesn't have to be a really expensive one, just one that you can use well. The little brushes that go in between the teeth, and with those you might need a few different sizes because the gaps are different between the teeth. And then regular visits to your dentist and hygienist, which in the long term, if you do that effectively, it might actually save you money on more expensive treatment because you're actually maintaining and cleaning your teeth well through these more simpler methods.
So actually coming back to actually cleaning products, is regarding toothpaste. So you go to the supermarket now and there are so many actually different brands, and even the different brands have got different for this and this and this and this. I'm just so confused.
So what I would always recommend patients is find a toothpaste that has some fluoride in there, because the fluoride is good at protecting your teeth from holes in them. And different toothpastes all have different tastes. So find one that you're comfortable with, that you like the taste of, that you're happy to use. It doesn't really matter too much which brand you pick. But, again, this can be quite specific to each patient. For example, if you're getting sensitive teeth or anything like that, there are certain toothpastes that are more sort of likely to help you with those things. But generally, any brand is okay. But I would recommend a fluoridated toothpaste.
And actually, what about where they said that actually this brand will help your teeth get more whiter, and this is for actually your gums, and does that make any difference at all?
In terms of the actual periodontal disease, the main things that will help you with that is the professional cleaning, the interdental cleaning, and the actual mechanical brushing that you're doing. The toothpaste is good as well, but it doesn't have to be a particular brand.
So if I can move on to asking a general question, what is the treatment for actually people that have gum disease?
So the main points of treatment when we are managing gum disease is firstly to focus on the hygiene and the cleaning. The reason we have gum disease is because there's plaque in the mouth. So if we can try and remove that plaque, that will help manage the gum disease. So the ways we do that is by going through your brushing, making sure that we're together, making sure that you're brushing really well, and then doing some non-surgical deep cleaning as well, which is where we clean deep inside underneath the gum line, where there's bacteria that's hard for you to reach just with your toothbrush alone.
So does that hurt?
We always make sure that you're nice and comfortable. So we would usually use local anaesthetic to numb up the areas to make it more comfortable for you.
Oh, brilliant. Okay.